I'm Ellen, I'm the service manager at the London East Safe House and I have been with the project for about 2 years.
My name's Kiran, I'm a modern slavery senior caseworker and I've been working at Medaille Trust for roughly a year and a half.
Many people who flee modern slavery have absolutely nowhere to go. We provide safe and confidential housing so that people who have fled modern slavery can recover free from harm. Thanks to our dedicated caseworkers, victims are supported to navigate the UK systems and they're supported to access all the help they need in their recovery journey.
So at the London East Safe House, no day is the same. Our days can look very different colleague to colleague or week to week, just depending on what we have going on that week for certain service users. It can look very different as well if we have a new service user in the safe house. So if we have someone in the house that needs a lot of support those first few days, we're making sure that they feel very comfortable in the house, they know where to access kind of local support in the area, getting them linked up with GP and trying to get them access to solicitors and other support networks in place. We also run different activities at the house. So we have a sewing volunteer come in and she helps the ladies tailor outfits or make things for the house. She actually made these pillows, which look really nice. And we have art therapy volunteer come in as well. She's from Street Talk. And again, that helps the ladies kind of learn new skills in terms of art, but also help them kind of release their emotions through therapy. So in terms of the support that we provide, we have monthly support plan meetings where we discuss with service users their overall needs in more detail. And so we'll discuss kind of any updates regarding their health, any concerns that they have regarding that. Also, any issues with the bank account or making sure that they have a bank account set up. We also discuss kind of if they want to learn English or any college courses, kind of how that's going. And we'll also discuss kind of what they do in their downtime or what they'd like to do in their downtime. So it's really kind of led by the service user as well. It's not just us leading the support. We hope that it's a holistic approach in terms of what we're providing. So for example, we have one service user who really enjoys being outside, gardening, being around plants. So we've tried to refer them to local community groups, such as Strength in STEM, so she can be around nature and also learn floristry skills. We've also linked her up with community groups in terms of gardening as well, and that has massively helped her mental health as well, which is really important, making sure that they feel empowered as well. So although we're helping them access these groups, those groups are really, at the end of the day, what's helping to empower them and feel independent and feel confident. Also, a big part of our role is risk assessing and understanding kind of the history of our client and making sure we're aware of any risks that there might be, and kind of talking with our colleagues, my manager, about how we can mitigate against those risks, put in safeguarding referrals if needed. And at the end of the day, it's about making sure that the service user feels safe, feels comfortable at the house, and we're doing everything we can to make sure that that is the case.
I think that one of the biggest frustrations for me working in this sector is just that there are so many misconceptions about what modern slavery is and how it looks. I think one of the most common questions I get asked when I tell people what I do is modern slavery really happening? And the answer to that is yes. I think that there's this view that modern slavery is a non-UK issue, and I think that there's not an awareness that actually modern slavery is happening on our doorstep. And it takes so many different forms and it impacts people in so many different ways. And I just hope that as a charity we can continue to raise awareness, we can continue to educate people, and together we can prevent modern slavery.
So a factor that I think really affects our service users' mental health, and I can see it affecting them, is the fact that there are limited move-on options for service users with no recourse to public funds. Many of our service users are extremely independent and they're ready to move on from the safe house, but because there is nowhere to go for them and they have really limited options, some of them have no options, that can really affect their mental health. It can disempower them, and it can kind of knock their confidence and their journey on their recovery.
I think that everybody's mental health fluctuates, and I think that there's so much stigma around mental health when actually it's something that affects absolutely everybody. I think that as a frontline practitioner, it's really important that we're always prioritising our own well-being. I think it can be so easy to focus on the mental health of the people that we're supporting and the people that we care for, but actually we have to remain well in order to be able to do that work effectively. So for me, that means taking the time to have a full life outside of work. It might be being around nature, it might be exercising, it might be doing creative hobbies or spending time with family or with friends. Our wellness activities are funded by the generous contributions of our donors. If you've enjoyed finding out about us this Mental Health Awareness Week, then please consider supporting us. We can't do this without you.